Hi, this video is the art of hair transplant restoration surgery result for 1 year post-op with before and after photo by Dr. Diep. Victor Cervantes will share his experience with the audience, what he went through and about the surgery and how surgery has affected him and how he's got his hair. And I'm going to show the audience what he looked like, and I'll turn quickly to Victor. And that's what he looked like before. Later, front view, right hand side, left hand side. You see how nice, thick volume density, but it's not just volume density, but it's naturalness. And that's where he was now and before. And now the stage is all Victor, and it's real. So whatever the video you saw before is now is real. Go ahead, Victor.
So basically I've been losing my hair since it started when I was about 21 years old. And it started to really thin in the front, and I tried, when it first started falling out, I really tried everything. I started doing Rogaine, and I tried Rogaine, and I tried this stuff called Scalp Med. I tried all these different, anything that came out on TV. And I really wanted it to grow, and it just seemed to still thin. It kind of maybe would slow down. Sometimes I was on Propecia too, and also try to slow it down. But I kept thinning, and I wasn't I didn't really stay on the Propecia because it bothered me sometimes. And so basically I used to feel really bad about my hair. It really started to look bad. I felt like I was losing my youth, and so I started using cosmetic things to make it look better, to enhance it. I would use like darkeners in my hair so nobody would know, or nobody would notice. But soon the cosmetic didn't work as well, and it started looking really bad. And so I started to research hair transplant surgery, and I started reading about the FUH and FUE method, and I read a lot, and I do a ton of research. And that's when I came upon Dr. Diep. And basically, I got something in my eye. So basically, what happened was I found him on YouTube, and I saw a lot of videos, especially from people all over the Bay Area. And I also looked in LA, actually, and of all of the doctors, I felt like his results were really the best, and I really liked that they look so natural, and I really wanted that natural look. I didn't want to look like I had something done. And I saw, when I saw the videos, I was really inspired by them. They really made me feel like, wow, this is not the end. I can do something about it. So I contacted Dr. Diep, and I had a consult with him, and he looked at my hair and he goes, you know what, I think I can do this. I think that you're a good candidate, and I'm gonna make you look like Ricky Martin. And we laughed about it, and I thought, oh cool, this might happen. Okay, so that so on the day of my surgery, I said, okay, you're gonna make me look like Ricky Martin, right? And he said, I'm gonna do my best. And the procedure was not as hard as I thought it was going to be. I was definitely very nervous about it. And I sat down in the chair, and his staff and himself made me feel at ease. They put me at peace. He's a very kind man. And once we had the procedure, I left. There's some discomfort, but not really something that I would say was painful or something that I should have been afraid of. It wasn't that bad. I went back to work within 3 to 5 days, something like that, probably 4 or 5 days. Started working again, and I started seeing results as soon as, I would say, 4 months, 3 to 4 months. I already started seeing kind of like things happening, darkening of my scalp, little hairs coming out, and I was really excited about that. And then when I hit about 4 to 5 to 6 months, I really definitely was having results. It really looked like my whole head was starting to get covered with hair, and I was really excited about that. Once I hit 9 months, I was already like this. Like, it was like amazing. In fact, I sent Dr. Diep a thank you email, and I sent him a picture of myself that I did for a headshot that I did, and I said, "You did it. You made me Ricky Martin." They're really happy. And I said, "See, you did it." And so I was really grateful for that, and that's it. And after that, my life has changed a lot. Like, I have to say, it really made my life, it really enhanced my life a lot, because I feel like myself again. I kind of feel like I'm in high school again. I can do things I couldn't do before. Like, I always was very careful. I only went to one salon, and only to one person, because I didn't want anybody to know that my hair was thinning. And then now I can go to anybody I want, and I can try new people, and I don't have to worry about them seeing my scalp, and no hairdresser can tell that somebody did something to me at all. Nobody can tell. And I can swim, I can jump in the ocean. I used to really be guarded, and I didn't want anybody to see my wet hair, and now I just jump in the ocean, I shower at the gym, and I brush my hair in front of everybody, and I don't use any cosmetic except for maybe some gel or something to style my hair. Right now I have like a more modern style, and I always wanted just to have something else other than the messy look, the cover. I always had the messy look, and I'm so happy. So I'm grateful to you, Doctor. It's beautiful. You did beautiful work, and thank you so much.
Thank you for the kind word, and you know, your results fantastic. So I want the audience to notice what he looks like before, and that's what he was, and this is after. And now I'm gonna, since it's an FUE, the audience probably want to know what his donor look like too, but I'm gonna show this view. Okay, now if you can turn to the right side, okay, there we go, that's where it is. If you can turn to the left side, perfect. Okay, now look at, see how natural his hair is. Excellent volume and density. Now if Victor, can you turn all around?
Sure.
So to show the audience what it looked like, and you can't tell, there's no, I mean, FUE does have scar, but the scar is so small it's hard to see. And Victor would like to wear his hair real short, Ricky Martin's type, or Adam Levine type, or you know, what's that guy, David Beckham. But all these have a very short shaving and no linear scar, tiny dots of scar. And look at his volume, it's excellent. And the most important thing is minimal scar allow you to wear your hair shorter. With the FUE, you had to find a surgeon who specialized in the art of and you can turn back, restoring hair using the FUE method. Because if you, there's three group of surgeon or clinic does FUE. One's FUE specialist like me, who personally pull the hair graft out. So the key word is, does the surgeon personally pull the hair graft out? Not does the surgeon operate. And all the surgeons will say they operate, but not all of them pull the hair graft out. So only the FUE specialist can pull the hair graft out. Most healthy graft with least transection have the best yield. When the surgeon who can only do the strip cannot do the FUE himself, so he buy this machine, the robots, and having the technician to operate and pulling the hair graft out. There's no way the robot can extract more healthier graft than me. Otherwise, I will buy 10 machine and just collect money instead of me sitting there pulling one at a time. The other machine called the NeoGraft. Again, NeoGraft is technician operating, they're not doctor. So imagine they design your hairline. One, is not going to be the same. Number two, their skill is not the same. So when it comes to FUE, you got to find a surgeon who specializes in the FUE, and then when you talk to the surgeon, you got to ask if the surgeon personally pulling the hair graft out. The other important thing is you got to make sure the surgeon emphasize the artistry of the hairline, because this is your face, you cannot have it messed up. And you can see how Victor is, his hairline looks very natural and very dense, and the surgical skill will give the density, the artistry will give the naturalness. And thank you, Victor, again for sharing your experience. The audience will certainly appreciate it, and I certainly appreciate it. Thank you.
Thank you, Dr.